Whereas, I think of IVC on a near daily basis. We refer to IVC all the time. And so I had to think through what is it that IVC brings. And I have had two things. One, the community aspect of walking alongside members of our community in various ways, in a myriad of ways, which is so important. And then on the more service side, on kind of the more nuts and bolts, that is unique to IVC and is essential in our community is the transportation piece. And that is what at least our clients rely on heavily.
Well, recruiting, identifying, vetting, supporting volunteers is a really valuable service that you provide to the community. And I think it is a way that people can engage. It's really clear what the value proposition is, and you can get people interested in volunteering in a way that it might be harder for us to do that.
So I think that for me, I see IVC as a really key, probably primary connector of senior citizens with various resources in the community. So whether people need assistance getting to a doctor's appointment or they need assistance walking their dog. My mom actually was a volunteer for a little bit before COVID. And so she met up with this older couple on the north end of the island. She'd go there 3 times a week and take their dog on a walk because they were too frail to take their dog out. And I thought, well, that's a really unique thing that I wouldn't have thought about kind of fitting into the purview of the organization. So tell you one thing. So your organization helps connect people to people and hopefully get some of that human interaction that maybe they otherwise wouldn't get. And I think for those who are most vulnerable that don't have friends or family on the island, I always envision IVC as perhaps the only interaction that they have in some circumstances.
Well, my understanding and what I've witnessed is that you are the only volunteer organization that is bringing volunteer services directly to people in whatever capacity they need. So I think it's a really great way for those who want to help others find a way to channel that. And then obviously for those that need assistance in whatever various ways to have that available to them. If someone needs their groceries picked up or to go to the doctor or library or wherever, there's not that service for most people. So it's really awesome.
Yes.
I can't think that there are other places that offer this type of, I don't know, I'd call it high touch, personal, directed to the client's need that is around.
Yeah,
I've seen IVC be a very essential kind of component to the everyday life on Bainbridge Island. My role is very much been centered around crisis work previously. It's starting to merge into, more supportive roles, but previously it was very crisis centered. And so I have seen IVC, especially during this pandemic, work at more of that functional day-to-day living level of community support. Older families and older adults in our community needed access to services that just weren't present or didn't exist in the last couple of years as we've gone through some really tough changes. And so having individuals that can drop off groceries or provide transportation or really just be a shoulder of support, I think is where I see the greatest value in my interactions with IVC.
Our 2 organizations work in very similar areas, and we do it in a way that we don't overlap. We really complement each other, and ties between our 2 organizations have just gotten stronger and stronger. And certainly through COVID and the vaccine clinics and all of that awareness that we are mutually dependent, that we're probably closer than your average collaborating organization. And I think that, when we're talking about this, I think there's no reason we shouldn't think about other ways that we can work together in the next 5 years for sure. I know the idea of having a physical space and now a virtual space where there are a combination of programs, information, recreation, exercise, socialization that are all sort of geared to people who are retired but still mobile generally, although not entirely. We've been working really hard on trying to make this as accessible as possible. But that sort of open community of activity, that adding zest to life, is really what we're all about. And one of the major ways we do that is by trying to support individuals who bring their own skills and talents, so that we're mostly saying, yes, how can we help you with this program? So we have somebody who wants to lead a discussion group, or we have somebody who wants to start a book group, or our movie nights are done by volunteers. They pick the movies, and we try to figure out how to set the table so that they can have a party. We're now using the senior center bus with your volunteers helping to coordinate where they're going to stop. Are they going to go to Trader Joe's? Are they going to go to Michael's? Are we going to, have somebody get off at Kohl's? What are we going to do? And that is usually an IVC volunteer who's helping with that. I've talked with Lynn about the idea of using the senior center bus if we had larger numbers of people to go on specific creaky knees walks. I think that there is some danger of overlap there, or there's also equally an opportunity for collaboration. Some things are going to be specifically suited to your particular population, which in the main is a little less mobile than ours, but not exclusively.
Right.
Something that Rita and Reed and Phaedra from HRB and I did at the beginning of COVID was weekly, and then we found it to be too much, but a check-in. We had a standing Thursday meeting, right? I forget which day it was, but it was both an opportunity. It was very needed at the beginning of COVID, when what is going on in the world? What is going on in your world? Is everyone okay? I'm okay, you're okay. Okay, that's taken care of. And then what are you doing about your programs? Have you gotten your PPP loan? What bank did you go to? So it was both kind of the meta aspects of connection across our nonprofit sphere, but also a very helpful place to ask these questions. Wait, I didn't get my PPP loan approved. Oh, I would suggest talking to so-and-so. And so a suggestion that is not unique to me, I would lift up again a quarterly check-in, if with those 4 organizations, if not more. I see 2 things. I see a lot of complementary avenues, and I see gaps, which we'll talk about, that neither one of us currently provides, and that's okay, because we do what we do. But I didn't come up with any glaring overlap. If anything, it would be the navigator position, and she serves such a need. I don't see it as overlap.
Okay.
Resources like bookkeeping, or human resources, or just keeping an eye to the idea that maybe there's some redundancies that we could avoid. Because I think that in many ways, in other communities, these organizations might actually be one organization. There are great benefits to us having separate focuses. But if we aren't sort of connected at the hip, we could very easily start to bump into each other on programs. So I don't know exactly what that looks like. Maybe it's a commitment to a working group to talk about how we might, what that might look like.
So every disaster, and again, these are big disasters and little disasters, affects your demographic more than others. And so, when we had the heat waves in the summer, we had typically older individuals come visit our cooling centers because they either have lived in their home forever and just don't have air conditioning, or they just can't cool down as well as somebody a little bit younger. Right. So I'm worried about what our next decade, 2 decades, 3 decades of summers is going to look like. Right. How it's going to affect your care receivers. You are our eyes on both specific instances of individuals as well as just kind of the general needs of that community. We have a team working with access and functional needs. That team has been alive in general concept and has been sort of a placeholder, but we're actually starting to make movements on kind of a plan for them, as well as our Map Your Neighborhood program, which is really like connecting neighborhoods together, connecting streets together, so that again streets are able to help themselves better than anybody else, in terms of in the very short term.
We do have many volunteers that are a part of multiple organizations, and then perhaps do some kind of, we could do joint messaging, joint training to say, look, if the disaster happens, like I would think that, especially if they're assigned to check on your care receivers, like that's priority. And then once that's done, then connect up with your nearest hub or whatever your other assignments are. So what are your 3 wishes?
Well, one of them would be that we had a stronger sort of one-on-one support, wraparound support for seniors. And I think that, to me, one of the biggest challenges right now for a lot of seniors is navigation of the bureaucracy and technology and coordination that goes into trying to live in the world at this time as your capabilities might be diminishing. So the kind of support that we're seeing right now with Katie Auger as our community resource navigator, working with IVC and with the senior center, it seems to me could only be strengthened by more understanding one-on-one of maybe not quite case management, but close to that, being able to help people survive these hurdles, try to figure out how to get on a virtual doctor's visit.
Chore work rose to the top with so many different anecdotes. Oh, my client this, and my client this, and my client this. My client she can't bend and mop her floor or her bathtub. But it's not qualified as an ADL, and so she can't get that service paid through DSHS. And so who is going to scrub her bathtub? And just various other small examples such as that. And so chore work that is beneath the level of what DSHS pays for. And then in-home care, which is paid, but there's a dearth of providers, and perhaps even further, a dearth of good providers. And so...
And we're talking about professional caregivers.
Correct. Correct. And so these were the conversations that these social workers said, someone needs help once a week showering. So to the extent that it is not a live-in care provider, that someone can largely live on their own, but needs the professional level with minimum, but needs medical expertise to do X, Y, and Z. And so that emerged as a great need.
Okay.
And the other was more and a variety of healthcare resources lost their providers and unable to find anyone that's taking any.
Yeah.
A surprise to no one is that what we heard was the social isolation piece, that people were afraid to leave their homes due to their own vulnerabilities, and those who for whom the fear of leaving their house prevented them from getting the food that they needed, which is where the partnership with IVC really blossomed during COVID and in such a needed and beautiful way. Intensive case management. So as people age, needs get a little bit more complex, and while we would be a resource, we certainly can. How we work is you come to us with a need, we help you in that moment, and then we send you off. And when you have another need, you come back to us. But we don't do the follow up. We don't. If something arises shortly thereafter, then you have to make another appointment, which could be a week to 2 weeks out. But there are at least a handful of people for whom having a singular case manager who is more available and really well versed in Medicaid, Medicare, DSHS types of things would be a benefit.
I think my first wish would be that more clinicians in our community accepted Medicare. That is a huge challenge. We have a robust amount of psychotherapists and clinical experts on Bainbridge Island. And unfortunately, the number that are paneled with Medicare is few and far between. And we know that things like anxiety and depression run rampant in individuals that are isolated, that are at a stage where they're starting to lose friends or family members. And we don't really have anywhere to refer them. And there's a lot of challenges of getting people connected to those services that are outside of Bainbridge, because then we're also looking at transportation costs. And so I would love it if more clinicians took on Medicare and took on Medicare clients in their practice. I think the other thing that, at least for my role, I see as a really big need is more discussion and community education on what aging looks like. I see people usually in a crisis state, and at that point, we've kind of missed some of the chances to really talk with caregivers and family and the individual themselves about what they want moving forward. I see quite a few people that have had, kind of light conversations with their family members about, what that looks like and what finances are going to look like, and at what point do we transition mom and dad into, maybe an assisted living facility or, things like that. But none of that is on paper, and so many of those pieces change as people's cognitive functioning changes. And so I would love to see, even though it's a tough conversation to have and it's uncomfortable, I would love to see more people in our community having realistic, hard conversations about at what point do we acknowledge that this is too much, either on my family members or it's not meeting my medical or health needs, and we need to change the plan.
System, but I just see a lack of coordinated care, right, between, if someone had a surgery, for example, the doctor at the hospital doing the surgery, and then the person goes to rehab, and then the person's supposed to come home, and there's all these disconnects between these things. And, we've seen with residents we know, and even just people that I know personally, that, they're going to release you. It is not, are you ready to go home? Is your house ready for you to come to it?
Right.
That's not a question,
Right.
right? No one asked that question.
Right. No one asked that question.
So the onus then becomes on the person who's obviously, undergoing this health issue, and then, or their family, assuming they have that support to help figure out, is the house ready for you?
Right.
And I think we could do a much better job as a society, if you will, in that area, and making sure people are ready, the house is ready for them.
Right.
And we understand that there are social workers in the hospital who make a plan, but the people to enact the plan weren't in place or aren't in place. And so doing that transition from hospital to home was brought up with the social workers as well.
Okay.
The problem of mental health and loneliness and all that amongst older individuals can be very severe, and it's an issue that affects many throughout America, old and young. But I see that as being another issue.
Yeah.
I have been working, but not successful, and probably not successful for a while, on essentially getting another medical clinic on the island. When Swedish left, thousands were put out of primary care. Some of that has been picked up by other clinics in the county, but not all. And as you mentioned, as we grow, as the demographic grows, and more people retire here, I don't see that problem getting fixed unless we attract more healthcare providers to the island. And then in general, on the county level, we have a hospital system that is problematic. We have a ferry system that is very problematic in regards to healthcare on the Seattle side, and accessing healthcare on the Seattle side. So.
And then a second is transportation. It should be seamless, and right now that's a real hurdle. Somebody decides they want to go to the senior center, or they want to take a walk at Sakai Park. They don't have a way to easily do that. And so to me, some sort of more flexible, almost on demand. BI Ride is sort of that, although the capacity of BI Ride does not match the need by any means.
Right. I think the other piece that is a huge priority for council, for the city, is to keep thinking about non-motorized transportation, safer sidewalks. I mean, coming from California, it was a huge shock to me to go around the island. I'm like, there's no sidewalks.
Yeah.
So bike paths,
Right.
more wheelchair accessible, sidewalks, things like that. I think that would be a huge goal that is feasible, that the community can continue to support. I know like BI Ride has been a really great thing. I think from what I hear, it's getting utilized in the community. So to have that on-demand access is a really great thing. So to continue that kind of service, expand those hours so that it's not just kind of weekday working hours, that it could be a little bit later and a little bit longer on the weekends. I think that would be a really cool thing as well.
More housing that can serve a very low income senior. We have a lot of seniors living in our housing. Our smaller units are largely seniors living in them, and more housing that comes with subsidy attached to it, because there are many seniors living on very little income. So a lot of some of the folks we serve are living on $1,200, $1,000 a month. They're having to pay rent and food and all medicine and all the things that life requires. So if I had my wishes, there would be a lot more vouchers in place to support housing needs of low income. Most of our residents have been longtime residents of this community, and they're trying to age in the community they lived in, right? And just, had, for whatever reason, have jobs that didn't provide them pensions and all of that, and so they're living literally on Social Security, the one leg of the three-legged stool, right?
Particularly for Bainbridge is going to that affordable housing discussion. You have people that are getting priced out of their homes. You have people that can't afford to pay rent anymore. We don't have enough affordable housing for anyone, whether for our city staff, for school district staff, for fire personnel. We need to recognize the impact that increase housing prices, increase sales tax, increase property tax. Just general cost of living goes up so much that it makes it not affordable for people to stay in this community. It was about 38% of city staff live on Bainbridge. The rest,
Bainbridge.
Wow. The rest live outside. I think the majority are still in Kitsap.
Right.
But there are some that are outside Kitsap County.
Right.
And my understanding is that's very similar for the school district and Parks District and Fire District.
So, but I do see that, as we have such a stratified wealth gap, right, with people on the top end able to do so much more, and than people on the lower end, and then the middle is slowly disappearing one way or another. it just seems unfortunate that once you are not in the top or higher income brackets, you lack choice.
Yeah.
So I think that while there's some concerning trends for sure, Bainbridge has a lot of hope in it.
Yeah.
I think that they're really willing to kind of step up to the plate for the community and figure out where we can kind of fill some holes and what else we're going to need to bring in order to fill the ones that the current agencies can't.
Right.
You know, as a social worker, my core values are around systemic approaches. And so I think the more that we can partner and the more that we can collaborate, it will actually make our jobs easier in the long run. So it might take a little more legwork in the beginning, but if it's going to be a benefit for the people that we're working with, like, let's sit down at the table and have a conversation on how we can work together.
Oh,
What is the definition of a livable community to you?
It's a community where everybody can thrive, that there is that sense of belonging and a sense of support. For some people, that's a little bit of support, and for some people, it's a lot of support. And I think that we're doing pretty well on the little support right now, but there are members of our community who we are letting down because there aren't the resources in place. And although in some parts of the world, there are government supports for that, this isn't where the United States is right now, and so it's up to specific communities to try to figure that out.
From the IVC side, definitely advocating for the needs of your community with counsel. And, you know, I'm not saying that this hasn't been done, but making sure you have a voice at council meetings, that someone is providing public comment, providing feedback on different projects, you know, finding a way to continually have a voice to support projects that are impactful to the community of all ages.
Right.
But that's a really key thing that I think makes a difference.
Yeah.
If I may, the city needs to redefine or refocus on their stated priorities, and include services for elders, seniors, you know, whatever, however you define it, and not be distracted by all of the other things. So I can't imagine what it would be like to constantly being told by constituents of all of the different needs that are going on, but nothing gets done if everything tries to get done. And so what they need to do is they really just need to focus, and they actually need to make progress instead of holding court for every issue that pops up. And I hope for Helpline to develop more clear advocacy stances on our various programs and our various things, and to just be very clear with that stance and continue to beat the drum.
You know, again, like, thank you for this partnership. I think that as we continue to refine our programming and your programming, to continue the dialogue on how can we be better partners and how can we make sure that we aren't missing anything when it comes to serving this population. I know that that's the end goal for both of us, right? Is to make sure that we're not leaving anyone behind day to day and then into the future of, you know, disaster response. We want to make sure that we've hopefully thought through as many things as possible. So
Thank you.
yeah.
Thank you.